I'm Rick Buck, and I've been a dentist for 16 years. In this video today, you'll see how I do a root canal on this heavily infected tooth and how the infection oozes out of the tooth. Let's first take a look at this x-ray, and you can see there is a lot of this shadow, which is infection around the apex or the tip of the tooth. So this should be exciting. We start by numbing the patient, and once they're numb, we almost always put on a rubber dam for these root canals. The rubber dam stops what is in your mouth from contaminating the tooth on the inside. But what is more important today is that what is in your tooth is not going to get in your mouth, and you'll see that would have been pretty gross. Once the rubber dam is in place, we start drilling through the center of the crown all the way until our drill bit drops into the infected pulp chamber. And you can sometimes feel that drop when it happens. Once it does happen, I use this pointed root canal explorer to see if I have access to the canal in the root. The canals in the tooth can be really tiny and hard to see. So if the canal is exposed, this explorer's point will wedge in the canal and it will get this little stick or resistance when I try and pull it out. And that's how I know I have found the canal. Once again, that point goes into the canal and it is kind of sticky because it's wedged in there when I pull it out. Once we have found the main canal, I'm going to start filing and shaping the center canal with my rotary file. The stuff I put on my file is a lubricant so my file doesn't catch and break in the canal when I'm working on the tooth. These lines that you see at the top of this file tell me how far I am filing in the tooth as I'm working. So that way I know I'm not going too far if I pass some of those lines, or I'm not going too short if I haven't reached to where I think the end of the root is. Now, when I put the white lubricant on, sometimes when you pull it out, you can see the white lubricant building up in the canal. But I also start to notice the lubricant is looking yellowish when I pull out the file. And normally it just stays white. This tells me that we have hit a reservoir of pus while cleaning the canal. So I normally have my assistant suction all this out before it gets into his mouth and just keep going. But today I'm gonna stop because I want to show you how the infection oozes out of the tooth. So I have my assistant stop with the suction, and now I'm just gonna look at it for a little bit. With my mirror, you can see it slowly rising in the tooth. Can you see it? Eventually, you will see all the infection and pus coming out. And since we are waiting to see the pus slowly build up, I will tell you how this happens. For one reason or another, the tooth starts to die, and there's plenty of reasons for that. You see, teeth are really bad at healing themselves. So eventually, if the tooth has had trauma that it can't fix, the tooth dies and it loses its blood supply. Quickly, before I get into the most interesting part, I developed the best toothbrush, floss, and other dental products that are in Amazon affiliate links in the description. And these dental products are more advanced and will give you a stunningly clean mouth. You should watch my videos about why they are the best posted at the end of this video so you brush and floss with superior results that avoid gum disease, cavities, and give you fresh breath. And with its blood supply, it loses the ability to fight infection. Once infection sets in, it eventually spreads to the bone around it. People often wonder, can't I just take antibiotics to get rid of the infection? Antibiotics will fight the infection around the tooth, but once again, since there is no blood supply in the tooth, the infection lives on in it. And so the antibiotics have no way of reaching the infection inside the tooth. And once the antibiotics are done, the infection moves on once again. Only now, if that happens, the problem is the infection is more resistant to that antibiotic. Antibiotic resistance is serious because if the infection starts to swell rapidly, the antibiotics will not be as effective in combating the infection. Okay, so hopefully you've had some fun watching this. Now let's just suction all of that up and let's get on with the rest of the procedure. Now I'm going to file the tooth some more. These files have a specific taper, and they come with these cones that have the exact same dimensions and taper that will fit exactly to the shape of the canal once you're finished shaping it with these files. canals. And then those cones will be used to seal off the canal. So after we're done shaping it and getting it ready for those cones, next we're going to kill off the majority of the infection by irrigating the canal with sodium hypochlorite. Yes, that is bleach. With just straight bleach, we're gonna kill this infection. Next, we're gonna fit the cones I talked about earlier into the canal, and we take an x-ray to confirm they are the appropriate length of the canal. We want the cones to fill the canal within a 0.5 millimeter of the apex of the root, because these are what we eventually are going to seal into place. And if it's sealed within that millimeter of the end of the tooth, then you're not likely to get reinfection. Now I have confirmed the length of the cone, and I'm going to irrigate with bleach one more time for good measure. And to do so, we use these paper points, and they as well are the same shape as that canal and the gutta percha. So we put a few of the paper points in and we let them soak up all of that bleach. Once dry, we mix up some sealer and put some on the cone, and we put it into place. Once the canal is dry, we mix up some sealer, and we use my Explorer and put some down into the canal, and we also coat that gutta percha cone with sealer as well. And now we put that gutta percha cone down into the canal. And for good measure, we also try to squeeze more cones down into the canal if we can, to make sure the canal is completely filled and sealed. With the canal sealed off, the infection no longer has a safe haven, and the body can kill off the remaining infection around the tooth most of the time. I then heat up this other instrument with a flame, and I use it to sear off the remaining gutta percha cones that are sticking above the canals. That way these cones are only in the root portion of the tooth, and the upper portion has no gutta percha. And then after that, we also have to clean out the upper portion of the tooth with kind of alcohol that we put on a little piece of cotton, and we clean up the excess sealer as well. Now, this tooth will need a post and a new crown to save it ultimately, because over time it's going to get more brittle, and that mixed with the fact that it doesn't have a core holding it together anymore, it's just likely to break over time. In fact, here's some footage of the next appointment with the post and tooth filed down for a permanent crown. I wanted to also show you the final results with a beautiful crown on top, but the patient never came back for the final crown. And without a crown, most root canal teeth will break within 1 to 5 years. So another dentist or I will likely take this tooth out in a few years down the road if he doesn't put a permanent crown on it soon. Unfortunately, this happens all the time of not taking the appropriate steps to fix a tooth. And this is likely how this tooth got here in the first place. I don't think that metal crown was meant to stay on there long term. So if you're gonna have a root canal, make sure you have the crown on it. I know it's more costly, but if not, it's going to break. And just for reference, here is another tooth that had a root canal. A few months later, he didn't put the crown on it and it broke. And now this was a very strong guy, and he grinds his teeth a lot, so he probably needed a crown on there pretty quick. We recommend within 2 weeks you get a crown put on after a root canal. Otherwise, about 64% of these will break within 1 to 5 years. Watch all my daily tooth care videos I have posted now for the best technique, tips, and products for a stunningly clean mouth that avoids tooth decay and gum disease and gives you fresh breath and white teeth. My dental products are in Amazon affiliate links in the description below this video. If in Southern California, my dental office is in the description as well. Like and subscribe to my channel if you have teeth.